So dyspepsia is a combination of symptoms, and it's quite commonly perceived, and patients do suffer quite a lot. So people, what they present with is, patients present with burning in the stomach, you feel bloated, you get heartburn, you feel upset stomach, nausea, sometimes you get vomiting, early satiety, so feeling of fullness, and burping. So these combination of symptoms is called dyspepsia. So not everybody will have all the symptoms, so some will have one, or others will have the other symptoms. So generally, 75% of patients who present with these kind of symptoms, it's usually functional. Functional means there's no cause for it, and when you investigate, generally investigations are usually unremarkable, but it does harbor a small percentage where you can get causes, about 25%. So I think the condition should be taken seriously, but nonetheless, you have to seek appropriate medical attention when you have these symptoms. So I think when you have symptoms, I think you should get a check with your GP, and especially if you're over age of 55, above 60, and you get these symptoms which haven't occurred in the past, I would strongly suggest that you seek medical attention. Now, not a lot of people will have, the pathology behind, will find a pathology. So as I said, 75% of these symptoms are benign. But nonetheless, if you've got these symptoms, along with if you're losing some weight, if you become anemic, if you're getting a difficulty in swallowing, if you've got vomiting, which is recurrent, and if you start passing black stools and things like that, you should seek urgent medical attention. Usually common in females, but men can have similar conditions, similar symptoms. Nonetheless, if you're smoking, if you've got a background of anxiety, depression, or some other mental health illness, I think it's really important to get help. Also, people who are on medication, especially anti-inflammatory medications, so sometimes that can cause, and various food allergies, food intolerances. And there's also a bug called Helicobacter pylori, which is a stomach bug, which can cause similar symptoms as well. Anemia is really important. I think once you become anemic and you have these symptoms, then I think it could be a sign of a cancer. So don't wait, seek medical attention. I think that's really important. So people do have symptoms of anxiety, and which also can present with dyspepsia. And anxiety itself can cause palpitations, shortness of breath. So you have to seek appropriate medical attention if you're getting these symptoms, because you want to really exclude that it is not due to other pathology like lung or heart.